Hey guys, Luis Moreno here with Simply Health Insurance Agency. Let's talk about this Medicaid unwinding and what's happening to people in the real world, and also what we can do as agents to help these people with ACA products. So before I do that, and it's an article I'm going to share with you guys, but before I do that, I want you to like, comment, subscribe to my channel. And after you see this, you're going to realize, or after you hear this and read it with me, you're going to see why we are so needed out there, why these people need good agents that can help them out. So let's take a look at this thing. All right. So this is an article from Kaiser. Okay. I get a newsletter from them, and I kind of look at their articles that they post out, and it's always a lot of good information. So this is the lost in the mix of Medicaid unwinding. Kentucky cut off her health care over a clerical error, which, from what I'm hearing, happens quite a bit. All right. So the day her Medicare coverage ended, Beverly Likens was in a hospital after a scary trip to the ER. The Kentucky resident was diagnosed with severe anemia and given a blood transfusion after her hemoglobin levels had plummeted. Likens, 48 at the time, was days from having surgery to treat chronic uterine bleeding that she said left her bleeding constantly. But soon a problem appeared. The hospital said she didn't have Medicaid coverage, jeopardizing her procedure. Likens, who is disabled, was rocked by the news. She believed she had done what was needed to maintain her eligibility. I was just getting ready to fall to pieces, Likens said, fearing that she was going to spend the rest of her life getting blood transfusions. Millions of people nationwide have lost Medicaid benefits after a pandemic area mandate for coverage expired in March. So there was a public health, I can't remember what it is, but anyway, bottom line, what happened is for 3 years, I believe it's 2 or 3 years, if people had Medicaid, they didn't have to renew it. They just let people have it from 1 year to the next year. Okay. Normally they have to reapply and qualify for it. All right. So we had this public health emergency. That's what it was, a public health emergency. So what happened is these people were just allowed to stay on it. So this public health emergency ended. And because it ended, what we call the unwinding, people were coming off the plans or coming off Medicaid. And now we've got some issues. First of all, 2 or 3 years of not having to apply, people forgot how to do it. Okay. These Medicaid carriers did let these people know, hey, they're sending letters or they're doing whatever they can to let these people know that they have to reapply. So here's what I have noticed. People, number one, are losing it because they don't know how to apply. They forgot. Okay. They thought it was just going to continue and they were going to keep getting, they were just going to stay on Medicaid. The other reason that I see people aren't getting it is because they no longer qualify for it. So at one point before the emergency, maybe they had it, but now because of their income and their assets, they don't qualify for it. So what happened is now they're losing it. And then the third is, of course, errors like this. Okay. So let's continue here. Millions of people nationwide have lost Medicaid after a pandemic mandate for coverage expired. Most of them for administrative reasons unrelated to their actual eligibility. Even the Biden administration and state officials had braced for complications in this historic unwinding of the continuous enrollment requirement and had assured the public they would guard against such lapses. Okay. All right. Let's continue here. Likens and an attorney who tried to help retain her coverage said technological errors in Kentucky's eligibility system and state missteps caused Likens' coverage gap, throwing her surgery into limbo. As her situation demonstrates, a lapse of even a few days can have life-altering consequences. All right, and we'll continue, okay? So the state never should have let Likens become uninsured, said an attorney. All right, fine there. Likens should have never had to reapply for coverage, Stewart said, arguing that the state violated federal regulations, they say, before concluding someone is ineligible and terminating benefits. Let's continue here. So Before she lost her coverage, Likens qualified for Medicaid because she had SSI, a program for people with little to no income or assets who are blind, disabled, or at least 65 years old. Likens has multiple chronic conditions, including diabetes, hypertension, and heart disease. And she said she initially got the program after her grandfather, who supported her financially, passed away. Likens was his caretaker and didn't go to college. Following his death, she grappled with depression, anxiety, and that she still treats with medication and therapy. All right. So apart from the limits on earnings, the SSI program limits beneficiaries' assets to $2,000 for individuals, $3,000. That's it. No more than $2,000. Jeez. After the Social Security Administration told her in March that she no longer was eligible for SSI because she had assets whose cash value exceeded those limits, a Kentucky agency that oversaw Medicaid sent Likens a notice in April stating her health benefits would automatically stop at the end of June. The state didn't assess whether she qualified on the way, even though regulations from CMS require states to consider all factors. Bottom line is she lost her coverage. Okay. Now, let's keep going here. We know that there's a bunch of issues. Look at this. Let's see. No, that's not what I want to know. Let's keep on going. All right. So given this high level of terminations, there's not much that these people can do. All right. Here's where we come in, guys. I'm seeing if there's anything here important. So what can we do? Okay. So let's look at that last paragraph. Likens was reinstated because her own income was low enough. Kentucky expanded Medicaid under the Affordable Care Act, which in 2023 means a single adult without children must earn less than $20K to qualify. All right. So she got Medicaid. If she was in a state like Texas, no Medicaid. Okay, there's a bunch of states that did not expand Medicaid. So what can we do as agents? We can let the public know, hey, if you're losing Medicaid, if your kids are losing CHIP, there are alternatives, assuming you can qualify financially for assets. You got to have a minimum amount of income. So assuming they can do that, we can help these people. It doesn't matter when they lose coverage. We can help them. So what do you do, agents? You put the word out there. Spread the word that if people are losing Medicaid, if they're losing their CHIP, that you can help them and that they could get a very good plan with subsidies, with cost sharing reductions that reduce the out-of-pocket and that reduces the deductibles, reduces the copays, if they qualify based on those on that household income. So hopefully it helps you out. I will share down below the link to this article. Maybe you want to share it out in social media and see what you can do to help some of these people out. Guys, do me a favor, like, comment, and subscribe to my channel. And then if you would, okay, spread the word. But I've got resources down below for you. Number one, I've got my ACA 101 class. I've got my smart books. I've got the CRM that I use. I use it for ACA for my consent and my confirmation of all the data. And then I also have my Facebook course, not mine, but one that I'm an affiliate with that I promote. Because of Shauna and this lady who put this course together, guys, I'm getting leads. I was getting them last year at about $4. Now they're a little higher. A lot of factors went into that that we can't control, but we are going to exceed last year's sales numbers. We sold a little under 1,400 new apps last year. Right now, we are about to cross the 1,100 mark, and we haven't quite. We're barely in December, so we're going to definitely exceed it. A lot of agents ask me, Luis, where do you get all your leads from? I create my own ads on social media. So if you want to learn how to do that down below, that's where you can get your, the link to purchase the course. All right, guys, thank you. Don't forget to like, comment, and subscribe.